Critical incident reporting. This course will cover a broad range of events that pose risk of harm and should be reported by parties within the organization as an adverse event. After completing this training, you will be able to identify a critical incident, identify things that should not be reported, and recognize when to report abuse, neglect, exploitation, and to whom to report. A critical incident is an event or situation that creates significant risk of harm to the physical or mental health, safety, or well-being of involved parties. It is an abnormal event out of the ordinary. Who do you complete critical incident reporting for? Any person served or staff member involved in a critical incident. Anyone who is aware of a critical incident or any behavioral health providers who witness an incident can and should report them. Critical incidents include, but are not limited to, abuse, neglect, exploitation, death, medical emergency, law enforcement contact, scheduled or expected medical procedure, medical errors, sexual misconduct, attempted suicide, serious injury, or rights violations. The intentional use of offensive or demeaning language by a caretaker that causes mental anguish of any person with developmental disabilities should be reported. The intentional acting or failure to act or recklessness that can result in injury or death to a person who is developmentally disabled or mentally ill should be reported. The use of bodily or chemical restraints on a person who is developmentally disabled or mentally ill, which is not in compliance with federal or state laws, should be reported. Unauthorized use of excessive force in the placement of bodily restraints on a developmentally disabled or mentally ill person should be reported. Corporal punishment of a developmentally disabled or mentally ill person should be reported. The sexual assault or rape of a developmentally disabled or mentally ill person should be reported. Failing to meet, either by commission or omission, any statutory obligation, court order, administrative rule or regulation, policy, procedure, or minimally accepted standard for care of person with developmental disabilities or mental illnesses should be reported. Failing to provide adequate nutrition, clothing, or health care to a person with developmental disabilities or mental illness should be reported. Failing to provide adequate numbers of appropriately trained staff in its provision of care and services for persons with developmental disabilities or mental illnesses should be reported. Failing to establish or carry out an appropriate individual program or treatment plan for a person with developmental disabilities or mental illness should be reported. Neglecting acts which cause injury or death to a person with developmental disabilities or mental illness, or which places that person at risk of injury or death should be reported. Inability of a person with disabilities to provide food, shelter, clothing, healthcare, or services necessary to maintain the mental and physical health of that person should be reported. An act committed by a caretaker or any person in a fiduciary relationship with a person with disability means using services of a person with developmental disabilities or mental illness without just compensation should be reported. Taking or abusing the property of a person with developmental disabilities or mental illness by means of undue influence, breach of fiduciary relationship, deception, harassment, criminal coercion, theft, or other unlawful or improper means should be reported. Using a person with developmental disabilities or mental illness for the entertainment or sexual gratification of others under circumstances that cause degradation, humiliation, or mental distress to the person with developmental disabilities or mental illness should be reported. The death of a patient should be reported regardless of the cause or setting in which it occurred. Death reports should occur during a time in which the program provider is responsible for the supervision of the program participant. Death reports should even occur during a period of time in which a program provider is not responsible for the supervision of a program participant. Admission of an individual to a hospital or psychiatric facility or the provision of emergency medical services that result in medical care which is unanticipated or unscheduled for the individual and would not routinely be provided by a primary care provider should be reported. Examples include emergency psychiatric services like inpatient admission, life-saving interventions like CPR, or emergency medical services like visiting an emergency room. Common emergencies in behavioral health include attempted suicide, presence of delusions, violence, or missed or delayed diagnosis. A person receiving services is charged with a crime or is the subject of a police investigation which may lead to criminal charges. An individual is a victim of a crime against the person. Crisis interventions involving police or law enforcement personnel should be reported. Through omission or commission, failing to comply with the rights to which an individual with a disability is entitled as established by law, rule, regulation, or policy should be reported. Any other injury determined to be serious by a physician or medical professional, like internal injury, fracture, a contusion larger than 2.5 inches in diameter, or the dislocation of any joint, should be reported. Whenever police is contacted, regardless of how long the person was missing, reporting should occur. Reports should occur during a time in which a program provider is responsible for the supervision of program participants. Reports should even occur during a period of time in which a program provider is not responsible for the supervision of program participants. If someone takes action to kill themselves intentionally, it should be reported. A suicide attempt is defined as the intentional attempt to take one's life. A suicide attempt is limited to the actual occurrence of the act and does not include verbal suicide threats by a person receiving services. When there is a discrepancy between what a physician prescribes, the medicine that an individual actually takes, and the individual self-administers the medication under the supervision of the program provider, or has medication administered by the program provider, it should be reported. A medical discrepancy is when one or more of the following occurs. An individual takes a dosage of medication other than the dosage that is prescribed. An individual refuses to take medication, resulting in a medical emergency or use of restraint. An individual takes medication that is not prescribed for them. Or an individual does not partake in a prescribed dose of medication within the 24-hour period of a calendar day. Any sexual activity between provider and a consumer, regardless of consent of both parties, or incidents of non-consensual sexual activity persons served, must be reported. Any person intentionally isolated or being forced to move away from others is considered secluded and should be reported. Any measure or condition that keeps a person under control or within limits is considered a restraint and should be reported. Any deprivation or restriction of personal liberty or freedom of the movement should be reported. Infection control refers to policies and procedures used to minimize the risk of spreading infection. Any communicable disease that threatens the health of others should be reported. This includes injuries but is not limited to injuries that cause bleeding or the release of any bodily fluids. Any behavior that can cause physical or emotional harm should be reported. These behaviors may range from verbal abuse to physical abuse. It can also involve the damaging and harming of property. Any illegal activity that involves a person served in which there is a weapon or chemical intervention is present or used should be reported. Every organization should have their own reporting procedures. Universal procedures would include critical incidents should be reported as soon as possible, and critical incidents should be completed on an incident reporting form. Things that should not be reported include scheduled medical procedures, emergency room visits for regular medical interventions as described in the Person Served Service Plan. However, if a person served has a scheduled or expected medical procedure, or visit which results in ER visits or hospital admits, please complete the critical incident report. It is important to realize that the health, safety, and well-being of persons served is the responsibility of you and your organization. Reporting reduces the risk of reoccurrence, it helps to improve the quality of service, and it helps serve to collect data for review and analysis which could lead to improving service outcomes.